The new accudxa2 from Lone Oak Medical Technologies provides healthcare professionals with a simple and fast way to screen patients for low bone density and its associated conditions such as osteopenia and osteoporosis. Low bone mineral density, or BMD, is one of the factors doctors consider when estimating a patient's risk of skeletal fractures. The accudxa2 test estimates the bone mineral density of the intermediate phalanx, a peripheral skeletal site with many years of clinical acceptance, and it uses dual-energy X-ray technology, long considered the gold standard for bone mineral density testing. Here's how the test works. Before starting the accudxa2 test, you'll want to seat your patient comfortably in front of the machine. Select the BMD test option from the accudxa2's easy-to-use menu system and begin by entering a patient ID number. Type in the patient's name or initials using the on-screen keyboard. Now enter the patient's age, gender, ethnicity, and dominant hand from the menu options provided. With all the patient data entered, it's time to place the patient's hand in the accudxa2. The accudxa2 on-screen prompts show you how to position the finger for optimal results. The accudxa2 features an easy-to-use laser positioning system to ensure that the patient's finger is correctly placed for middle phalanx imaging. Ask the patient to put their hand into the accudxa2 with the laser line just crossing the middle of the knuckle. Good finger placement is important because it improves the accuracy and repeatability of the test. The accudxa2 takes a positioning or scout X-ray at low energy to verify that the middle phalanx is completely visible. The bone outline is displayed on the accudxa2's screen, and the operator reviews the image to confirm that the finger is where it needs to be for the test. Here is an example of a properly positioned finger. The entire phalanx is visible in the image, including the cortical regions at either end of the bone. In this example, the patient's hand was placed too far into the accudxa2 and has to be repositioned by moving it slightly further out. You can see that the cortical area on the right-hand side of the bone is missing from the image. Here, the patient's hand was not placed far enough into the accudxa2. It has to be repositioned by moving it slightly further in. In either case, the accudxa2 makes it easy to reposition and check the finger. Simply touch Reposition, move the patient's hand in or out as needed, and follow the on-screen prompts to retake the positioning X-ray. Now that the finger is placed correctly, the accudxa2 takes 2 X-ray images for dual-energy X-ray absorptiometry analysis of the patient's finger. In a few seconds, the accudxa2 computes the patient's BMD estimate, along with a T-score and a Z-score. The results of the test are displayed on the screen for immediate evaluation by the physician. The accudxa2 can also print out a test report on an optional printer. The accudxa2 automatically stores each test result in its large 8GB memory, and it can reprint test results if needed. Finally, the physician reviews the results of the test with the patient. For more information about the new Lone Oak Medical Technologies accudxa2, visit our website at accudxa2.com or call us at 1-888-818-4BMD.